From the outset, a firm decision from city schools. The methods would be tested, but the endpoint certain, a return to in-person learning. Joining us now is Dr. Sonia Sanalisis to talk a little bit about getting kids back into school. Good to see you.
Good to see you too, Jason, as always.
Hey, listen, you got a task ahead of you right now. So many kids have spent the winter break, whether it was at home or with family or abroad, whatever, and now all concentrated back in schools. How big of a task is it for you to make sure they come back healthy?
No, it is a big task, Jason, and particularly with the increased community spread that, everyone around the country and the state is experiencing with the Omicron variant. We really are working diligently to make sure that our systems continue to be robust and with mitigation. So we're working hard. Today and yesterday we had first wave of staff in. Some schools, some of the high schools began testing for students. We've had a real positive response from parents because there's such a kind of dearth and strain on testing availability in the city. Knowing that schools are providing that testing has been an additional, I think, comfort or support at least. But it is challenging. We know that there's, that there's going to be some trepidation on the part of families, on the part of staff. But one of the things that we're continuing to echo is that our mitigation strategies that city schools have had in place, we are continuing those, we're improving those, we're adding on those. And really what the data is continuing to show us, we know we're going to see a surge when we get back because we've got a surge in the city. Mm-hmm. But by starting the testing early, we really believe that we're giving our families, our schools, the tools to be successful and continuing with masking, our ventilation systems that we replaced over a year ago with federal dollars, the air purifiers that we inserted. All of those mitigation strategies are in place for a moment like we find ourselves in now. Because the most important thing is keeping kids in school. Sorry, Jason.
No, that's okay. I'm curious of how this feels different to you compared to what we've been through already. Because remember, kids went back without shots at the beginning, and we were doing masking and the plexiglass and everything. But there's a heightened alert, it seems like, right now heading back after this winter break.
Yeah, and I think a lot of it, Jason, is the spread, is just the rapid nature of the spread, the fact that this variant over and over again is showing, not just here, but across the world, that it spreads more quickly and more easily. And so I think that has a heightened sense of anxiety for folks. I think, though, another plus that we are seeing, and again, we are working very closely with the city health department, with health advisors, with folks in epidemiology on this. One of the other things that is a plus, it's a silver lining, is that particularly for children and those who are vaccinated, both adults and children that are vaccinated, we are seeing not as great, not as widespread a negative impact, specifically as measured by hospitalizations, when we're looking at that. So, but it's scary for people. Sure. There's far more folks catching it, but we're hoping and really working with the fact that, like, right now we're seeing kind of less of the most extreme negative impacts. Not that ever getting COVID is a good thing. Sure. So I want to stress that, but what we're seeing is we have more tools in place now than we did 2 years ago.
Two things from the teachers union. I want to get a barometer from you, how you feel about it. One, they're asking for more collaboration along with the school system. Is that possible? And then two, their idea of, listen, everyone takes a test and you're not allowed back into the building until you can prove that you have a negative test. So tell me about those two things and what you think.
Sure. So no, on the point of collaboration, Jason, one of the things that continues to be true is we meet with the Baltimore Teachers Union weekly. We had a meeting with the team just earlier this week. I believe it was Monday. I had a conversation with President Brown over the holiday break. And so we will continue to work. There are some of the things that we have heard from parents, from teachers that have led to some of the adjustments that we're making. So we're always open to that. But we've also said that our priority is keeping young people in school and not having just extended closure after closure. And that part we can't do, but absolutely continue to be open. And that's why we have weekly meetings. And that's why we have exchanges and dialogues and always open to that.
And getting back to if you come back with a negative test, is the idea that kids won't come back until they can, I'm sorry, positive tests, kids can't come back until they are indeed negative, correct?
Yeah, so part of what we are working on now, because the CDC protocols are changing almost weekly with this. So as of right now, and this is, as it stands now, when young people test negative, when staff test negative, we're continuing with the 10-day quarantine, right? So part of why we got started early is we did hear from folks like the BTU, like parents, and just, medical professionals, that we wanted to give some extra time for young people, staff, all adults, frankly, in the system, to be able to get that testing to mitigate. But as of now, we are still on the 10-day window for negative results, that we are also looking at some of the new CDC guidance. And I've been talking with Dr. D and others about the new guidance around 5-day quarantine, but we're not quite there yet.
All right, that's Dr. Sonia Santelises wishing you a healthy and happy restart to the school year.
No, much appreciated, Jason. And since we're both parents with kids in the system, we'll get to see firsthand.
Oh, yeah. Fingers crossed. Keep them in school. All right, ma'am. Thank you.
Thanks so much, Jason.